Yo, yo, yo. What's good? What's good, everybody? Good morning, or good evening, or good afternoon, wherever you're joining me from around the world. What's good, y'all? How's everybody? Man, these weeks be going like whoop, 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 whoop. These weeks be going so fast, man. So, wow, man. So, what's up, guys? I hope you guys have been having a good week, man. My week has been super, super busy, man. You guys are making my life busy now, so I like that. Keep it up. What's up, guys? What's up? What's up? What's up, Kent? What's up? What's up? I see you, brother. I see you. Oh, I think I just hit something I shouldn't have. There it is. All right. What's up, brother? What's up, brother? So, guys, where are you? Where are you guys viewing me from? Make sure you guys smash that like button. It helps push this out. This is a very important live. I'm just gonna put all of my stuff that I want to tell you guys in the beginning and throughout. But I got a jam-packed day of live stuff for you guys. Today, man, we're going to talk about, let me get to my stuff here. So, man, today our topic is going to be healthcare for retirees here in Vietnam. All right. So my goal for you guys by the end of this live, you guys know everything about pricing. I'm going to break down the different types of hospitals. I'm going to break down in Da Nang hospitals, Ho Chi Minh hospitals, Hanoi hospitals. So I got insurance stuff for you guys. So we got a lot to go over. So just hang with me, go get a beverage, and yeah, let's do this, man. So where you guys viewing from, man? Where you guys viewing from? Let me get my banner. Yeah, and make sure you guys hit that like button for your boy, please. I see these comments are building up on me already. Nice. Okay. So shout out to UK. This is inspired by him. He's in this live right now. Him and I were talking on the back end, and so he brought it up to me. I realized that a lot of YouTubers don't really talk about, retiree stuff, except for Evan and then Vagabond. But yeah, I want to give you guys some really in-depth stuff. Also, I'm going to introduce, by the end of this live, I'm going to introduce a little surprise for you guys coming up next year. Basically, what we're going to do, I'm going to set up a trip. I have itineraries. I have a couple itineraries that I'm looking at, and I'm going to offer 10 of my subscribers. If you can see that, I'm going to offer 10 subscribers an opportunity to travel with me, and I'll take you guys on that 3-week. You can do 2 weeks. You can do a week of the 3 weeks, but I'm going to do 3 weeks of travel with my subscribers, and you guys can come along. So I'm going to give 10 people an opportunity for that. So you'll be hearing about that. Yeah. So stay tuned. I'll give you details toward the end of the live. So, all right. So let's jump into it, man. So healthcare for retirees, man. So this is a big thing. although I'll say this in the beginning, there's no retiree visa at the moment. That doesn't mean that you can't retire in Vietnam. Okay. So when I talk about retiring on this channel, until they actually get the retirement visa together, we're going to be talking about forms of retirement that you can retire for, like doing visa runs. That's basically it, or marriage or business investments. So you can do visa runs, and if you're okay with that, cool. If not, maybe Vietnam is not for you. So let's jump into it, man. Let me share my screen with you guys. Don't forget to hit the like button, man. And if you guys want to support, I always forget this. People have been asking me, how do I support the channel? If you don't like the videos or watch all the way through, then you can hit the Cash App, and that would really support the channel, help me grow this thing. And so if you want to do that, thank you. If you can't at the moment, then just hit that like button, man, and just watch those videos. I'm trying to blow up over here, trying to help people like I'm helping you guys. All right. So segment number uno. Oops, that's my little typo. Excuse me. Let me fix that real quick. So we're gonna go to segment number one. And again, if you guys have any questions, feel free to just leave them in the comment section. Specific questions or not, again, my lives are for you guys that give you an opportunity to answer your questions. All right. So I'm gonna be here for about 2 hours, and then I'm gonna cut you guys out. All right, cut you guys go. So segment number one, let's talk about it. Healthcare. So we're going to do the basics for now and dive in. So let me share my screen with you guys. Bear with me, and we'll get it going. I wonder if let's go with this file. Yeah. All right. Come on. It's loading. I promise. It's loading. Let's get to some of these comments though. You guys are building up on me. All right, Kay, we got you. What's up, Kay? Thanks for coming, bro. Appreciate you, love. Fred, hey, Fred, what's going on? Fred says, yes, it's excellent. Yeah, what's up, Fred? How you doing, man? K-Dog, USA NorCal. Yes, sir. Yes, sir. Bliss Horizon. What's up, brother? Good night to you, Kev. Well, good morning for you. Vegas. Let's go. What's up, Vegas? Hey, man. Thanks, Bliss. Appreciate you. Fred says, I live in Cam Mi, Vietnam. Cam Mi, Vietnam. Okay. All right. I've never heard of it, so it must be small. Thanks, Fred. Appreciate you. Let's go. Let's go. Thank you, Bliss. All right. Young Fresh Global Travel says, hey, I sent the Vietnam Embassy an email. They have not gotten back to me. Not surprised. Yet about an appointment for a visa. I hear a lot of people talk about doing everything online, but I'm in New York. You got some more. Hold on. It's not easy to apply here. They ask you to email a Gmail account, which is weird. Yeah. Yep. And he says you should do a video on how the visa and not just talk about it. Well, true. I can do that. There's many. Thank you for the comment, man. There are many YouTubers who have already done it. I will do one as well. But basically, I'll say this. If you have any issues with that, I understand it. There's a video is not going to change it. Okay. It's not going to change them getting back to you. FYI. Okay. You here in Vietnam, you got to go direct. This is what I say on my consultations is that they're inundated with their web portal. Here on the ground, you guys don't know this, but here on the ground, they're changing everything, okay? Like digitalizing everything. So it's a process now. We can't even process work permits right now. So what do you think that's going to do for online visa process? This is Vietnam, all right? If you want a faster visa, hit me up on the back end. I have agents here who can help you out, get you a visa in 1 hour, 2 hours, 1 day, 2 days. they can do it. Seriously, I've been doing it all week, literally this week. Okay, so if you have any questions, hit me up. The Story of KT, channel name at Gmail. Okay. If you want to wait for your appointment, they'll probably get back to you next week. But understand and have patience that it's just crazy here right now, man. So yeah, thank you for the recommendation, man. I appreciate it. And yeah, I'll do one. I'll do a video of that for sure. Appreciate you, man. Young Fresh Global Travel says, I have been matching with some nice Vietnamese women, but I can't get an appointment to save my life for real. I feel you, bro. I feel you. I feel you. Well, just hit me up on the back end, bro. I can take care of that for you. Not even a problem. All right. So let me share my screen with you guys. Appreciate all the comments. Appreciate all those comments. Let's talk about it. All right. So basically the basics of, let me break this down for you. Healthcare here is tricky. Okay. So basically, most foreigners will go to, if they have like major problems, will go to an international hospital versus a public hospital. Obviously, public hospitals, they don't speak English as well. I go to a public hospital near my house. They speak enough English for me to get what I need done. Okay, so don't think that you have to go to an international hospital. All right, you can save a lot of money if you go to the right public hospital. All right, so let me just get that out there, is that foreigners do go to public hospitals, but majority of the we like it the way we like it. Let's put it that way. So why do they use private? Why do they use it? Right. Well, obviously it's modern, right? It's more cost effective than in the West, hands down. And honestly, I'll say they have top of the line services. If you're going to go to a public hospital, they're not necessarily going to have those services that we're accustomed to in the West. All right. So, yeah, but I'll go like that. So as far as a private hospital, it's cleaner. Let's be honest. I'm gonna give you the real. And the language barrier is like, right? Most people speak English there. And let me show you. On the next slide, we're gonna go over an article, all right, and I'll break it down for you. Okay, so just bear with me now. So obviously, hospitals that have accreditation are going to charge more. Meaning, if they win awards, let's just say if they win awards for great service, for good departments, then they're going to win. They're going to cost more. So, and they're going to be much nicer. All right, and I'm going to show you this later. It's important when you're in Vietnam to have these emergency numbers, okay? 113, 114, and 115. And I'm going to break those down for you. Police, 113. 114, I think that's fire. And 115 is, let me see. I always get these mixed up because, see, I don't even have it. I'm going to come back to you on that one. I'm going to come back and get that because I don't have it right up in front of me right now. But just make a snapshot. When you're in Vietnam, these are the emergency numbers you need to have. I put that in my last video. So yeah, go check that out. Let me keep it moving. All right. So let's talk about some insurance and coverages. Let's go like this. Let me give you that article. Let me share my screen. I got a lot going on right here, guys. So just bear with me here. So let me remove this and share this screen with you. All right. So understanding the fundamentals, right? I want you guys to understand more about how the healthcare in Vietnam is, okay, and what you can expect as a retiree coming here and being taken care of. All right. So Vietnam is fastly becoming a popular choice for expats. The country offers an ideal combination of good good earning potential, low cost of living, and high quality of life. Healthcare in Vietnam combines an aspect of Eastern and Western medicines to treat most medical issues. All right. So plans are currently underway to develop a universal healthcare system, which is really cool. As it stands, most Vietnamese citizens have to pay for medical services themselves at both public and private hospitals. Okay, many cases people who can't afford to opt in go to private facilities. All right, the difference between public healthcare and private healthcare. Let me explain this for you. Public expats who live in Vietnam often report that the standard of the country's public hospital is not on par with what they are accustomed to back home. Okay, these are what expats are saying. I agree. I generally agree. I didn't come to Vietnam to expect top of the line stuff. Okay, remember, this is Vietnam. This is not the West. Okay, so you really have to keep that in mind. Most of you, I think, have traveled, but if you've never traveled before, don't come here expecting to get the best of the best unless you want to pay for the best of the best. Okay, I see far too many expats, travelers who become new expats complain about this stuff, and it's like, but this is why we exist, us YouTubers. This is why we're here, is because we explain this stuff to you guys. So public hospitals in Vietnam are often underfunded and inadequately equipped. Doctors and medical staff at these facilities generally only speak Vietnamese. Furthermore, waiting times can be frustratingly long. In rural areas, the quality and availability of healthcare is considerably worse. And in some of the more remote parts of the country, public healthcare is almost non-existent. That is true. Okay, this right here, in the countryside, you probably, some areas you're gonna have to drive an hour, right, over mountains and stuff, or just through farmland. Okay, so again, it's not as developed. They're developing. Okay, but they just be patient with Vietnam. Okay, again, you're moving here and you're traveling here to look for a better way. Okay. If you want everything done for you, stay at home. Seriously, come visit, but just go back home. Okay, I keep it real with you guys. So yeah, public hospitals, they're cool. They're getting better. Some of the nicer ones are getting better, but most of the services are going to be here in private. Okay, so private healthcare in Vietnam. The standard of private hospitals in Vietnam is excellent and more or less in line with standards that most of us expats are used to. Private hospitals in Hanoi, Saigon are often staffed by doctors and medical professionals who completed their studies in the US, Korea, Japan, and France. Furthermore, as doctors in these hospitals have often trained overseas, they are generally likely to speak good and excellent English or French. All right, that is correct. Okay, and then you when you are at these hospitals, you realize that generally their staff, like the Vietnamese, they know more or better English. Okay, basic treatments at private healthcare facilities is usually covered by international health insurance. Okay, that's huge. All right, let me say that again. Basic treatment right here. Basic treatment at private healthcare facilities is usually covered by an international health insurance policy. All right, that's huge. So it's just like home. Make sure you get health insurance. If you are a retiree, make sure you have that. Okay, and before you leave wherever you're from, the West, make sure that you have a conversation with your insurance company. Let them know what country you're going to, Vietnam, and then, or if you're traveling, let them know which countries you're going to, and see if you can get a letter or something in writing that says that we cover this stuff. Okay, and then make sure you get your benefits. Okay, make sure you get that from your insurance, just in case. You never know. All right. The costs associated with specialists such as dentists or dermatologists can vary considerably. So expats should research which treatments their health insurance policy covers, just what I just said. While prices for specialist treatments are still relatively cheaper or more affordable than what uh, than what one would pay in many other countries, practices that market themselves for expats tend to charge more. Yeah, I agree. Stop right there. So yeah, like I said before, health insurance in Vietnam as the national health insurance plan in Vietnam is still a work in progress. Locals who can afford it tend to arrange private coverage. Again, duh, right? So have private coverage. For expats, it's best to invest in an international health insurance policy before arriving in the country. Just what I just said. Okay, pharmacies and medication here. Expats can rest assured that pharmacies in Vietnam are well respected within bigger towns and cities. That is correct. You don't worry about your medication here unless it's very rare. Okay. They are usually located on shopping streets or in malls or generally well stocked. That is correct. They have everything that you can get. Generally, it's going to be like a generic brand. It might not necessarily be like Pfizer, but it'll be a top of the line stuff. So, yeah, you don't have to worry about that. Health hazards in Vietnam. By taking some basic precautions, expats can minimize the chances of experiencing major health hazards during their stay. Tap water is not good to save, not safe for drinking, and expats should drink bottled water instead. Yes, don't drink the tap water. Okay, you can brush your teeth. It's okay. Okay, I always cringe when I see people say that they drink this with bottled water. I understand. I get it. Right? We have our preferences, but I brush my teeth with this water, no issues. All right. Avoiding ice in your drinks. That is a big one. Okay, that'll lead to you having a bad belly. Okay, you never know where these restaurants source their water from. Okay, some of them or a lot of them will do tap water, so just be careful. All right. So avoiding ice in drinks at bars and restaurants is also recommended. Yes, temperatures in Vietnam can soar. Sunburn, sunstroke, and dehydration are significant problems for new arrivals to the country. Always wears always wear sunscreen with high UV protection. Yes, yes. This country is hot and humid year round. Okay, so this is why you see me in dry fit all the time, dry fits, because you don't want to wear cotton here. Okay, you're going to sweat to death. All right. Those who plan on spending a significant amount of time in Vietnamese countryside are advised to go on a course of malaria medication. Yes, right here. Right here. Okay. If you decide to live in the countryside, understand that there are mosquitoes here. Okay. They have dengue fever. You can get malaria. It's not common. Okay. Malaria is not common here, but dengue is common here. Okay, so make sure that you guys can get the necessary vaccinations before you come. All right. All basic vaccinations, such as COVID vaccinations, should be up to date before moving to Vietnam. Expats traveling from parts of South America and Africa may be required to get yellow fever certificate. Okay, so if you are from some parts of South America and Africa, then you may have to get yellow fever. So check that out. Okay, make sure you do that. All right, emergency numbers in the event of a medical emergency in Vietnam, call 115. Period. All right. Now this is really important. Okay, you guys have seen the traffic in Vietnam. All right, you guys know how this works. Now, when you're on the ground and you see an ambulance coming behind you and no one gets out of the freaking way, that's a problem. That's the difference between life and death right there. And people, they don't move out of your way. Like, that's a problem here. You got to have more respect for emergency vehicles, Vietnam. Like, honestly. It's like, what if that was me? You know, I'd want. What if that was you? I'd want them to get the hell out of the way so they can get me to the hospital. That's a problem, guys. Really. So, unfortunately, ambulance response times are generally slow, and people don't move out of the way, and they probably don't speak English. All right. So that's that. That's that. That's the basics of what this is all about. Okay. So let's go over some of the hospitals. I want to just give you an overview of some of the hospitals, and let me share my screen. Let me see if we got some comments here. I don't see any comments. Okay, let's keep. Oh, wait, I do have some comments. Sorry, let me look. Okay. Bliss says 115 is ambulance. Thank you. Thank you. Appreciate that. Yeah. 115 is ambulance. So Bliss Horizon says, what hospital in Ho Chi Minh City can a military veteran with an FMP letter go to? That is also a private hospital. Okay. I will get back to that question because I'm about to get on this. You generally might want to find out from the Veteran Affairs in the U.S. if that's where it's from. So talk to them, see if they, because I know, or talk to your insurance, whoever that is. I know that they'll have a list because I know one of the retirees just sent me a list of theirs to look over, and FB, Vinmec, and it was included. So yeah, they should have, your insurance company should have a list, or the Veteran Affairs. Just ask them. But I'll answer your question in a bit. So let me just start that, and I'm gonna come back to it. So let me put a pin in it. Thanks for the comment, my boy. I appreciate you. So let's go like this. Let's get that out of the way. All right. So there are in Ho Chi Minh City. Let me see. Where am I at? So first of all, the international hospitals, I will tell you. But first, we have Vinmec. We have FV Hospital, which I go to. I love FV. F as in Frank, V as in Victor Hospital. FV Hospital. There's Vinmec, 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 and then there's Raffles. It's a Raffles Medical. Anyways, there's a couple other ones, but I'm going to show you this right now. Let's go into our next one. So that is just kind of the basics of the healthcare system here, what you can expect versus private versus public. All right. So let's get into some insurance and coverages, and then yeah, if you guys have questions, just keep going, keep putting it down there. Let's get into. Let me share my screen. Bear with me. All right. So local providers, right? Insurance coverage. We have, and these are just some, okay? So local providers are Pacific Cross and Bao Viet. Most, I'll say the bigger companies that I've worked for use Bao Viet. It's pretty good. But international ones, we have Alliance, we have Aetna, and then we have Cigna. Also, I'll put in some obviously travel insurance, Safety Wing, IMG, and then obviously direct billing hospitals would be those big boys, right? Those international hospitals. So FB and Vinmec and the FMP. So yeah, basically what I'll say this. If you're coming from the West, get international insurance, okay, and make sure that it covers, hospital stays. Just make sure it has adequate, more than adequate. I wouldn't do the minimum or the minimum. I would do the mediums, okay. Make sure that it covers you enough, okay, because you just never know what's going to happen here, right? So comment which insurance are you with, so that I could look and kind of do some research for you. But yeah, let me know like what insurance company you guys are with right now, and do they cover international travel? All right. So basically, these hospitals are, these insurance companies. Go talk to your insurance companies. If you want me to do a specific video about insurance and coverages in Vietnam, I will. Just let me know in the comment section. But it's not a whole lot to talk about with these guys. I mean, they're pretty straightforward, and I it's boring. But just so you know that these insurance companies will they like to play games. Let's just put it that way. I heard a lot of expats here say that their insurance does play games. All right. So just be careful. Just be careful. All right. So Vinmec, bear with me here. I'm grabbing this. Let me share my screen with you guys. Boom, boom. Let's go like this. Okay. So this is Vinmec. Okay, this is one of the big boys that are here. So FB Hospital is a big boy, and when I say big boy, I mean international hospitals that are like, all right, that you're gonna want to go to. Okay, so Vinmec is one of these hospitals that they're just fire. Okay, these are the insurances that they accept right here. Okay, I'm going to say just a few of them. All right, Alliance Partner, AIG. If you see this, if you see your insurance company on there, just let me know. All right, I'll go slow. Okay. Okay. So basically, and here's their page, their payment procedure. Okay. So if they're gonna direct bill you, you can see these steps, right? Outpatient department, step 1, you're gonna complete the compensation request form. These are all the steps you're gonna need. All right. Provided, and again, there is specific information from the paper, the actual paperwork to claim to make claims. There's specific wording and specific paperwork that the hospital needs to put in your claim in order for you to expedite your claim. Okay, so make sure that you have whatever specific information they need. Make sure don't leave the hospital until you ask these questions, because if you've ever been to a hospital, it's hard to track down these doctors, okay? Really, after the fact, because they're just so busy. All right. Step 2 is going to be patient signs the invoice and receipt to confirm the services used. Okay. Inpatient department, step 1, same. Step 2, Vinmec contacts the insurance company to obtain a guarantee letter. So this is, obviously, that's standard. Okay. Step 3, you'll probably be on the bed, and this is step 3. They'll come, and Vinmec informs the patient of the outcome. So, did you get approved? Did you not? And then either you're gonna have to pay, or your insurance is gonna cover you. Number 4, patient signs. Obviously, you sign and then you pay. Okay, or they pay for you. If they cover you, they'll pay for you. Okay. Don't run into situations where your insurance, usually these big hospitals are good about getting you all the information, whether you're covered or not, ahead of time, before you get their services. But again, Vietnam is very affordable. All right, you can pay out of pocket too. It's not that bad, trust me. All right, so here's your indirect payment breakdown for you. I'm just gonna leave it there for a minute. And just talk to you guys. So, what questions do you guys have for me about insurance? It's pretty cut and dry. So this is Vinmec's process, and And obviously, I can show you other ones, but this is generally how it's going to be. This is generally how it's going to be, for all of them. Okay, pretty straightforward process. So the most popular regional expat plan here is Pacific Cross Vietnam. So that's the one that they use. Basically, we all use. Okay, I don't use them, but I know a lot of people who do. All right. Second one would be Bao Viet, insurance company, and Alliance Care would be the third. For like short-term medical insurance or like travel insurance, definitely Safety Wing. All right. Let me show you guys Safety Wing. Just give me a minute. I know a lot of you probably have seen Safety Wing, but you probably haven't gotten a good idea of what Safety Wing offers. So bear with me. Let's go like this. All right. So Safety Wing is, again, short-term and short-term travel. Okay. They do. I did see that they do have products for like nomad insurance, right? And then this is like when you are actually stationary in wherever you're at, Vietnam or Thailand or Philippines, right? So let's check out their insurance, and they charge you by every 4 weeks. It looks like. I'm actually going to reach out to these guys and get an affiliate link for you guys. So if any of you guys are interested in Safety Wing, probably this week I'll have a link for you guys in all my descriptions for the Safety Wing, so you guys can check them out. All right. Let's see here. Let's go like this. Okay, we'll go like this. So travel here. So essential. Their travel and medical insurance covers up to, obviously you can see, covers up to 364 days at a time. Treatment for new and unexpected issues while traveling, hospital stays, surgeries, medications, lost luggage, travel delays, emergency evaluations, and it's 30 days of coverage in your home country. Okay. So yeah, you can use this when you're chilling in your home coverage, Vietnam, Philippines, or wherever. Okay. But this, again, they have the complete. So full health insurance with extra travel protection. Basically, a month is going to cost you $161, $162, let's call it. Okay. Routine and emergency medical care anywhere in the world. This is the one that I would get. Ongoing coverage, renewable indefinitely. Cool. It covers wellness therapy, mental health support, and cancer treatment, burglary, canceled accommodation, delayed luggage, no coverage restrictions at home. Okay, that's cool. Let's check this one out real quick. So let's go over. Let's play with this. Play with me live here, guys. Because real quick, pause. Okay. Let's do this. I'll do this for myself. So I'm 40 to 49. Want to add extra coverage. Hong Kong, US, no. Let's go dental coverage. And let's leave it at that for now. So obviously you can see this is a monthly price, right? So if I just went to their website and I just did this right now, then I would pay $262.50, and it says paid monthly 12-month commitment. So you're gonna pay every month, or you pay upfront. I don't know. Let's see. Annually, it's $2,835. Huh. Okay. There you go. That's actually really good to see. Okay. So you could do monthly. Let's see how easy that process is. So yeah, you'll connect. I don't want to connect. I'm sure you'll set it all up. You'll give them your information, and then you'll have an account. So yeah, so to go back to let's just say you're 18 and 39, right? Same thing, 181. Cool. Almost 2,000 for the year. Okay. All right. What about 5059? Okay, jumps up quick. All right. Total cost per month is 300, almost, let's call it $400 US. Okay, that's an apartment you could be getting over here. Okay, 400 USD per month. You're gonna spend $4,293 with safety wing for the year. Okay, and what about if you're 60 to 64? Obviously, 707 USD. Let's call it 708, and then $7,641 a year. I mean, to be honest, that's not bad. That's not bad. It really just depends on the coverage, and what the finer details say. Um, so the difference between these two, here are their plans, right? So overall coverage limit is 250,000, and this complete one is going to give you 1.5 million USD. Okay, you see the difference. Okay, I'm not going to go through all of it, but you guys see the difference. Boom. Okay, this here wellness, that's really good in therapy when you get here. It's really, really good and important. And if they cover it, man, that's even better. All right. So I think with insurance, I'm good on that. I think you guys should be all right. Let's keep it moving. Let's keep it rocking to our segment number 3 here. Let's talk about the actual international hospitals and their pricing. All right. So bear with me. Let me let's get here, and let me move this out the way. All right. So international hospitals, here, I already said it again. Ho Chi Minh City, they have FB Hospital, Vinmec, Central Park, Vinmec Central Park, and Raffles. Okay, Raffles. Anyways, Ruffles. So Da Nang, they have FM. We call it FMP, Family Medical Practice, Vinmec, and Hoan Mi. Hanoi, they have Vinmec, like Time City. That's like an area, and Hanoi's French, so that's like FE as well, and Raffles. Okay, Ruffles. So generally, it's gonna cost you generally between like 60 USD and 80 USD. I'm gonna break this stuff down for you. Specialists are gonna cost between 80 USD and 120 USD, and dental crowns 250 USD to 400 USD. All right, this is at the big boy hospitals. Okay, so let me click out of some of this stuff here because I got way too much stuff here. All right, let's look at FB Hospital. Let's look at FB Hospital first. So basically, I'm gonna go on to their websites, and I'm gonna show you, break down all their medical stuff. I do have some pricing for you guys as well. All right. So let's see if you can see. Perfect. So FB Hospital. This is where I got my MRI and X-ray I was telling you guys about on the channel. All right. This hospital is fire. Okay. These guys are amazing. So, and it was so affordable, I couldn't believe it, for them being such a nice hospital. All right. So FE Hospital. Generally, let's see, where do we want to start? Here? Let me see. I think I had some. Give me a minute here, guys. I just need to find out. Okay. Yeah, I got pricing here. Yeah, I'm sorry. I didn't pull up the pricing for FE. Anyways, let's go over. Bear with me, guys. I wanted to departments. I'm looking for their departments. Medical services. Okay. Okay, so these guys have, their departments are pretty legit here. Okay. This is what I would see in the US. Okay. So look at this. I'm not going to say all of them, but you can look at it. They have basically everything. Okay. Everything you need. Where did I go? Let's go general practice and just pull some of them up here. Their website's not the best. I'm gonna lie. Here are their here's some doctors in the general practice. Okay. Obviously, you can see that these doctors are pretty legit. Okay. And these are the doctors that you're going to be checking out. Okay. So you can see bear with me. Let's go to, I don't know, let's go to surgery. Let's go here. Okay. Okay, cancer, lung cancer. Interesting. Again, these doctors have studied quite significant time and probably have been abroad, to be honest. I'm not gonna lie. All right. So I'm just giving you an overview. I'm just, just real quick about, I want you to see, literally see these doctors. Okay. All right. FB is a great hospital, guys. Just take it from me. Okay. At FB Hospital, we focus on patient-centered care. We put you first. Not only do we strive to provide our patients with high-quality medical care in a safe environment, we also offer excellent customer service and a level of comfort similar to a five-star hotel. This is correct, guys. These guys are fantastic. I can't say it enough. Let's look at a room. So a typical room is going to look like this. Okay. Boom. Boom. Right. So these are the types of hospitals that rooms that you're going to get. Okay. Obviously, there's different coverages. Okay. I also have heard there's VIP rooms that look a lot better than that too. Okay. Financial information. Let's see. Payment policy charges no. What is packaging pricing? So again, hospitals will take a deposit before admitting. Sometimes they will. It just depends on what's wrong with you. But generally, I think these bigger hospitals will take a deposit. All right. Basically, FV Hospital is a great hospital. I want to move on to Vinmec as well. Trust me, if you need more information about these hospitals, just message me. I'll send you the information. Let's go to, let me get that out of the way. Let's go here to raffles. Bear with me. Share my screen. Boom. Okay. So this hospital is in Ho Chi Minh City. Like I said, this one is in Ho Chi Minh City. And here's some pricing. Okay. Doctor consult fee may vary between clinics. Obviously you can see this, right? These are their treatment plans. Okay. So all of this stuff is in. So again, you can see the difference between a Vietnamese price and a foreigner price. So I'm right here. Foreigner price, Vietnamese price, right? Look at the difference. This is what I'm telling you. Okay. This is why it's important, even though it's still a lot more affordable than that you would pay in the US, it's still not okay. Okay. I know it exists. I get it. But at the end of the day, I don't think Vietnamese should be paying, $3 million. I think they should stay where they're at. But I think that they should be bringing it down for us because there's really no difference. Okay. But you can see that their standard medical consultation, 30 minutes. It's going to cost you about $2 million for a resident doctor and an expat doctor. So a resident doctor obviously is a local. And then obviously an expat doctor is an expat doctor, someone from abroad. Okay. So 2 million is about $50. Let's just call it $50. Okay. So still, this one is going to cost you about like 56 56 US. Let's call it 60. Let's just round up, make it easy for you guys. Okay. So, no more than 60 USD. So still, you either have 50 USD for a consultation or 30 minutes or 60 USD. Okay. Obviously, this one right here, this is for an hour of consultation. This is over $100. It's about $100 actually. It is $100 because 2.6 million VND is $100. Okay. Obviously, this one's going to be what? So that's about like 106, 100, and let's call it 110. Okay. Obviously, they have 24-hour, emergency medical. So if a doctor's not around after hours, they got to come over and get you. You see the difference. Okay. So you guys can check that out. You can pause it, come back, check this out. But yeah, these are just prices. Again, in the public hospitals, you're probably looking at spending a tenth, probably 30% less than this, for sure, if not 50% less. I'm being honest. All right. Yeah, some of these you probably even pay 60% less. I'm not even gonna lie, because these are pretty high prices. Okay, from what I'm looking at. Let's go to Vinmec. Vinmec, and then I'll get to your comments. All right. So this is Vinmec, as you can see up here in where my mouse is. Okay. And these are the three of the bigger international hospitals here in Vietnam. This is why I'm showing you guys these guys. All right. I'm not going to show you all of them because we'd be here for hours. Okay. But general GP pricing, right? With an appointment, 440,000 VND. That's like $30, 30 USD, like 36. Without an appointment, it's gonna be $50. Consultation with a specialist. Okay. 350K is like $15. 690, obviously, with and without an appointment. Make an appointment, it saves you money. See the difference between making an appointment, not making an appointment. See the little changes. FB didn't have that. Raffles didn't have that. Raffles didn't have it, but then Vinmec has it. So again, does it matter? My clients ask me, does it matter which hospital I go to? Well, yeah, you can see it. This is why, because they'll charge you a lot. Okay, if you don't have an appointment with Vinmec. All right. Let's keep it moving. So emergency exam, you can see these prices, guys. I can send you the information if you need. Okay. But just ask me. Or email me, thestoryakt@gmail.com, and I got you. So yeah, I'm not going to go through all of this, but you guys can see these pricing. Okay. And I'll just leave it there for 10 seconds. Again, pick the right hospital. You could save money. I'd go to FB, but I've heard Vinmec is pretty good as well. All right. Let's see where we're at. Let's see. So I got some comments here. Okay. So Bliss Horizon, if you were still with me, I hope that I answered you a little bit better, and you got a better sense. Talk to the Veteran Affairs. Make sure that which hospital they cover, and then they'll give you a letter. Okay. Other than that, I'll still come back to this comment. I have it starred, so just hang with me. Yeah, you're welcome, bro. You're welcome. All right. Unfairly Stoic says thoughts on check D. I don't know. I don't know what you mean. Let me know. What's up, man? How you doing, bro? Unfriendly Stoic says, I heard you can compare international healthcare plans on that website. Yeah, definitely. Which one are you talking about? Safety Wing? Thanks for the comment, bro. Based on your particular needs. Yep. Bliss Horizon says, is Humana? I don't know if I'm saying that right. Is Humana and or WellCare insurance good to use? I've never heard of them. Maybe somebody below can help my boy out because I've never heard of them, to be honest. So, yeah. Hopefully someone can help you out. Thanks for the comment, though. Kay says, I am from the U.S. I am from the U.S. My insurance is Blue Shield. They told me that I have global coverage, including Vietnam. Sorry, guys. Kay says, I am from USA. My insurance is Blue Shield. They told me that I have global coverage, including Vietnam. Ho Chi Minh City has 17 international hospitals, which are in network. So yeah. Thank you, Kay. For sure. And this video is this live is because of him right here. So shout out to you, Kay. Yeah. Again, check your talk with your insurance, guys. That's all I'm saying. Talk with your insurance. It shouldn't be a problem. Just like Kay did with Blue Shield. Definitely, they gave you a list because he sent me his list. This is what I'm talking about, okay? But he sent me his list and of Vietnam. So they should have that information for you guys. All right, K-Dog, thank you, brother. Appreciate it. Unfriendly Stoic says, I since braces for like 600. I spent braces for like 615 USD in Ho Chi Minh with monthly plans. I remember paying a few grand, my mom at least. I was actually laughing, okay? Paying thousands of dollars 10 years ago, Vietnam for the dub. Yeah, I agree. Again, later on, I will bring up the care here. Just FYI, just a little plug. Vietnam is one of the best in the world when it comes to dental care. Just saying. Thanks for the comment, bro. Appreciate it. Travel the World says, probably best for retirees to stay in a major city for good healthcare. Yeah, I absolutely agree. I absolutely agree with this because, yeah, it's funny. Little caveat. So when I was in the Mekong like 2 months ago, you'd be surprised how many like older expats or older travelers I saw just walking throughout this little tiny small city of Chodok. And so it's just a small little town, but there was a lot of older retirees there. I couldn't believe it, man. I was like, what the heck? So yeah, for retirees, honestly, go be adventurous, go have a good time, but just make a day trip back to the big city because God forbid if anything happens, you just want to make sure that you have access to that healthcare. Okay, remember it's a developing nation still, so just make sure that I would rather my viewers and my subs stay in the bigger cities for now till you get your feet wet on Vietnam and you understand you've been here for a few years, and then go and be adventurous outside. But just visit, but don't go live outside. All right, that's a great point. Thank you, Travel the World. You're the man. Unfriendly Stoic says, check DI. I think I'm saying that right. I never heard of it, bro. Enlighten us, my boy. Thank you, man. Appreciate the comment. All right, so let's jump. Let's get into some regional and U.S. comparisons. So basically, what I want to do is I want to talk to you guys about the difference between Thailand. I'm not going to go through their specifics, but just price-wise comparison. Thailand, the Philippines, the USA, and versus Vietnam. Okay. Obviously, we all know Vietnam's going to win. Vietnam for the dub. But let's go like this, right? Thailand has higher prices, of course, right? But they have better infrastructure, okay? Better doctors, because they're known for this stuff. Better doctors, better health coverage in general, okay? All around the country, all right? From what I've seen, right? As far as the Philippines, it's kind of the complete opposite, right? So they have like some poor infrastructure. They have some poor infrastructure. They do have international hospitals. It's pretty affordable, but it's also very, very expensive. All right. So their prices are going up. This is what I've been looking at. Their prices be going up. So again, we're looking at a country where the infrastructure is not as good. It's further away from the mainland. It's in the middle of just in the middle of the ocean, as opposed to it's landlocked. So you have access to and faster, better international hospitals. If something happened, serious, you can get airlifted somewhere else instead of being in the Philippines, right? Just saying, it happens, right? As far as Cambodia, Phnom Penh's the main city, obviously the capital. So, yeah, I'm not terribly familiar with what Cambodia's got going on, So if anybody's in the comment section and you guys are on this video, let me know because, tell the people, man. Tell the people what they're like. I know that the infrastructure is not as good as Vietnam, okay? And and I know Cambodia is more expensive than Vietnam. So, again, Vietnam for the dub, all right? Benefits for Vietnam is that it's affordable here, it's modern, and there's like low wait times, right? As far as Vietnam versus the U.S., I don't think we have to go into that. We all know, right? The difference between Vietnam and the U.S., since I've been to even the hospitals here, public and international, the biggest difference is wait time. I walk into the hospital, I get there, right? I get seen right away. Like it's like they're waiting on us. Like seriously, they're sitting there waiting at the door at all entrances. They're waiting for you. They welcome you, and then you're in. You fill out the intake form, and then they obviously figure out what's going on with you, and then they take you to that department right away. Like they escort you there. That's the biggest difference between the U.S. and Vietnam is because ain't nobody waiting for me in the U.S. Nobody was waiting at the door for me. I had to have a gunshot or a serious crime, a serious injury in order to have somebody waiting for me. Here, they welcome you, right? And it's cheaper, and it's not, and you have a really nice room, and they have good food. And usually, the big ones have really, really gourmet food. Okay. And even that's more affordable. So FYI, okay. In the U.S., obviously, my fellow Americans, we understand what it is. It's not affordable. It's either do I pay my light bill or do I go to the hospital? Do I pay my rent or do I go get my medication? Okay. Here in Vietnam, you go to the pharmacy. They give you, babe, can you give me some medication, like the pills? I'm going to show you guys. I'm dealing with literally right now, right after this live, I'm going to the dentist to help my, I have to get a root canal. So yeah, I wanted to do this live first before I did that. So any kind, baby, any. Thank you, baby. All right. So let me show you guys what it looks like to get medication here in Vietnam. Okay. Don't mind these, but they will give you singles, right? In the US, we're used to packs, right? So they will go inside the pack, they'll go into the pack, and then they'll give you, they'll take out a sleeve of these, right? And you're like, whatever your prescription says, they'll give you that amount, right? So they'll prescribe you, whatever your doctor prescribed you, they'll give you that amount. They're not going to over give you. Okay. So they'll give you like these type of stuff, right? They'll give you the actual medication, not the box. Okay. So if you know how it is, Ben, when we go to the pharmacy, they're like, no, we just give you a box. You're walking away with a box and you only need it for like 2 days, but they gave you 7 days worth, right? So that's the thing I like about Vietnam as well. And it's cost effective, right? So if I need one, you'll get one. If you need 20, you'll get 20, right? So that's the cool thing I like about Vietnam. So yeah, that's that. And the medication here is fire. My tooth, it's been hurting for a while. It's been hurting for like a week, 2 weeks already. And I went to go see them, the dentist. And the cool thing is they have dentists all around your neighborhoods. Okay, neighborhoods. I'm not talking about you got to go drive to the shopping center to go to the dentist. No, it's right in my neighborhood. I can walk there. Okay, and it's top of the line. Okay, I think for this root canal I'm paying 1.5 million, and that is like $50, like around $55. Yeah, out of pocket. So there you go. That's real life. Let's see where we're at now. Anybody have any questions so far about anything, what I've been addressing? Am I going too fast, going too slow? Let me know. Yeah. So again, that is the comparisons between these. To me, there's no doubt. If you're looking for more of a real world experience, you're looking for a country that's coming up, that has good healthcare, right, in the bigger cities, guaranteed. Okay, I would choose Vietnam, guys, really, because it's going to save you a lot of money on procedures. Okay, and I will absolutely be getting some doctors that I can talk to and nurses. So look out for a video that's going to be coming probably within the next 2 weeks, okay, somewhere around there, that I'm going to interview a doctor and see what I can do, all right, for you guys. I see a question here. Unfriendly Stoic says, it's a website to compare international healthcare. Oh, okay. Can you write it out for me? Can you write it all out for me, and I'll pull it up. Thanks, bro. Appreciate it. Bliss Horizon says, you are doing fantastic. Thank you, bro. Appreciate it, man. Appreciate the love. So let's keep it moving. Again, smash that like button for your boy, man. This is a subject people don't really talk about. As far as if anyone has any questions, let me know right now, okay? Let's see what else I got. Bear with me. Okay, FB's good. I see I do have a comment, so I'm going to come right back to you. All right. So dental, like I said, dental is amazing here, guys. And I should have actually went to go get it and then come back with right and show you guys, but I'll save you the details. Okay, dental implants. This is a general ballpark: 600 USD, 900 to 950 USD. Right? USA usually costs $3,000. If anyone has ever gotten dental implants in the US that is on this live right now, let me know in the comment section. Is $3,000 generally what they charge? Because if it is 600 to 950, Vietnam for the dub, baby. Let's go. So again, high quality of care, and Vietnam is known for dental tourism. FYI. Okay. All right. Thank you, bro. I see you. Unfriendly Stoic. I see you. So high quality dental. And so like just much like Thailand is known for their healthcare, their healthcare tourism, Vietnam has always, I knew this before as well. I knew this 5 years before I got here about Vietnam's dental and how cheap it was. Back in the day, it was way cheaper. I think right now is the best time to be living in Vietnam, and because of you can get all your teeth done. I'm literally about to get my teeth, done, um, and get them back to health status, right? So I'll document that process, and I will tell you guys exactly what it looks like. Okay, firsthand. This is what this channel is about, guys. First-hand experiences from other expats. That's why I do interviews and interview expats, and for you guys, all right. So you guys can get that real world experience and real understanding. All right. So, and the reason why I like the Vietnam is because it's affordable for Vietnam, the health coverage, okay, the dental, right? So, and like I said, there's definitely international staff that work for these dental clinics and that work for in probably more so in the international hospitals rather than the local one, right? So I'm going to a local dental clinic that's in my neighborhood, for example, and they don't have any international staff. So their doctors make sure their just do the research, okay? When you go to that. But those doctors so far they were peach, okay? They don't really see a lot of foreigners either. So they made me feel like a celebrity. So and they'll bring you right in. There's no wait time. Generally, they'll just grab you and bring you right in. And I literally just went right upstairs, sat in the chair, and she was on my mouth within 1 minute. So, yeah. All right. So, any questions about any of this stuff so far? I'm about to open up. I'm gonna open up to you guys and have you guys come on. If anybody wants to come on and join me, we can have a conversation. I still got some more information, but I'm trying new stuff during the lives. I would like for you guys to not just listen to me, but like come up and have a conversation with me and just kind of give your sense and like introduce yourself. And again, this channel, it's about meeting you guys. Okay. It's about real world experience. I'm not just some dumb YouTuber. Okay. I know what I'm talking about. I've been here. I put in the work, and I want to help you guys. So I want you guys to give me your input. This is not a presentation. This is we're family here. Okay, we're family. So come on up. If you want to come up, I'll throw the link in the description and come talk to the family, man, for real, or girl or lady. Just give me a minute. Bam. So if you want to come and join me, come chop it up. All right. So yeah, stay in the bigger cities and TLDR, stay in the bigger cities, get health coverage with insurance, and make sure that you can either pay out of pocket or your insurance will cover it. Either way, it's still affordable. Okay. Dental, I'm just going to go through this real quick. Okay. We learned the difference between public and private. Okay. Public's pretty good. Private's excellent. Okay. Obviously, we already know why we chose private versus public. Okay. It's better. They are accredited. Okay. Emergency number is 113 police, 114 fire, and 115 is, I forget what it was, emergency, I believe. Ambulance. 115 is ambulance. Okay. 113 police, 114 fire, 115 ambulance. All right. Shout out to Bliss. All right. So Insurance, obviously, we went over it. Start from the bottom. There's two different types. You can either have direct billing or insurance billing. I'm not going to really go into that again, but the direct billing, if it's out of pocket, it's about 30 to 40% cheaper or more affordable. Okay, more affordable than Thailand. Tell me I'm wrong. Tell me I'm wrong. All right, travel insurance, Safety Wing is pretty solid. IMG, of course. There are other ones that are there out there. I will be setting up a Safety Wing affiliate link if this week, like probably this weekend, to be honest. And if you guys are interested, it'll be in all my descriptions. So go check it out. International coverage or insurance, Alliance, Aetna, Cigna, Blue Shield, right? So just find out if your insurance company covers Vietnam, okay? Or while you're traveling. Then find out the small little print, okay? And local insurance, if you don't want to get, if international coverage is too much, and you think like, well, I think that they're ripping me off, you can come here, get some local insurance while you're here. It will be more cost effective. And some of these companies, you can get the best, top of the line insurance, which probably would be Cigna's mid, you know what I mean? Or basically. So it is worth taking a look at, to be honest, while you are in Vietnam. And I'm sure that those local insurers do have like a 30-day or a 60-day or like the duration of your visa. Okay. So if you're interested in that stuff, hit me up and I'll point you in the right direction. Let me get rid of this. Let me get rid of this. Okay. Obviously, we talked about the international hospitals and their pricing. Okay. If you want more specific pricing, then you would have to contact those hospitals directly. Okay. I am in the process of breaking down a ton of different pricing, getting different stuff for you. But I wanted to bring something on the live now for you. So that's that. Okay. If you guys want to come on the show, the link is in. This is the link. Come and check it out. Come talk to me. Come chop it up with your boy. All right. So we talked about international hospitals and their pricing. Obviously, the bigger international hospitals are going to be in your Ho Chi Minh cities, your Da Nangs, and your Hanois. But the best hospitals I've seen so far have been in Ho Chi Minh City, period, hands down. Okay. Again, Da Nang has family medical practice, FMP, which is nice. Family medical practice is pretty dope. Okay, I'm not gonna lie. Vinmec, very dope. Okay, I know they're top of the line. Okay, again, general costs are gonna cost between $50 like GP general practice consultations. You saw it, $60 USD to about $80 USD, right? To have them come to see them. All right. Remember, Vinmec. Remember that Vinmec charges per if you have an appointment or not. There's two different prices. FB Hospital didn't, and then we checked out Raffles didn't have either. Okay, but Raffles did have foreigner pricing, Vietnamese pricing. Okay. Again, this is what I'm saying. It's important which hospital you choose just because of that. All right. So I would say then specialist costs, these are all just general figures. 80 USD to 120 USD, still 40% cheaper than what it would be like in the US for sure. Dental crowns anywhere from 250 to 400. Okay. Now, again, you can find cheaper or more affordable. Okay. For everyone who says, stop saying cheaper. Okay. I get it. Okay, but it is cheaper. All right, but it's more affordable than the U.S. More affordable than Thailand. Okay, more affordable than Philippines. All right, and it's better. All right, so we also talked about regional versus regional, meaning Thailand, Cambodia, the Philippines. So again, we compared that versus Vietnam versus the US. Okay. And obviously, US, that's the highest. So whatever, we're not going to go there. But as far as regionally, Thailand, we already went through it. Thailand has better infrastructure, higher costs. Philippines has lower infrastructure and good infrastructure, but rising costs. All right, and they're isolated. Cambodia, if anyone knows anything about Cambodia's, I don't know anything. I've never been to a hospital in Cambodia. However, I know that their hospitals are probably going to be more expensive because their infrastructure is weaker. All right. But I'm sure they do have international hospitals. I'm not familiar with Cambodia. Okay. So the benefits, again, of Vietnam's hospitals and healthcare are it's affordable and modern, and they're waiting for you when you come. And they speak English, okay? Internationally. Okay. Again, when you've lived here for a while, like I have, you can go to these public hospitals and be like, hey, I'm just gonna go to the public hospital because I know what I'm doing, right? So for example, for a health check for someone who's working here for a health check, it costs 600K. What they do in those health checks, I have a video probably about a year ago that's on this channel. I have a video a year ago that went through the process of going through it. You'll see it down there. It's about like a 5-minute video. And they give you a full, like, not drug test, but a full like panel. Like they make sure your blood tests, urine, they take care of all that stuff. Okay. Check your eyes, your ears. They put stuff all in here, my mouth, my nose. They're doing all kinds of stuff. All right. And that's 600K, which is slightly over, it's like $24. Okay. 24 USD. All right. So yeah. Again, we just got done with dental. So again, dental implants, 600 USK, 600 to 950 USD versus 3,000. Okay. So again, Vietnam has top of the line services. Like, it's known for that. If you didn't know, now you know. Okay. Vietnam is known for dental tourism. Let me say it again. Vietnam is known for dental tourism. Okay. So doctors from outside, like international doctors, they come here and start their practice dental because it's that good here. So if you have any dental issues, come to Vietnam. Get it, or when you come to Vietnam, make sure you get your grill taken care of. All right, it's super important. I see some comments I do have, so let's jump into it. I'm Friendly Stoic says check di.com. All right, solid, man. Appreciate you. All right, K Dog says I had one dental implant on my way, number 4 tooth. Oh, okay. I had one dental implant on my number 4 tooth, extraction plus implant, total cost about $5K, only one tooth. Wow. That's US pricing 2024. See? That's crazy. That's only one tooth? Holy. See? Guys, come to Vietnam, and when you come to Vietnam, get your grill done, okay? I'm telling you. You'll be messaging me later, and you'll call me later and go, KT, good looking out. All right, good looking out. All of your dental needs, all of it. Get it done here. Okay. Just like you would go to Thailand for health, come to Vietnam for dental. All right. Because, and soon enough, Vietnam, if not, has already surpassed Thailand for health, like actual health plus dental, because of the international hospitals, not the normal public ones. Okay. They're internationally standardized. So, I mean, Thailand doesn't have tooth dental certifications and stuff. They don't have dental. All right. So, man, I've been talking a lot for the last week, I swear. All right. My boy Zen, what's up, Zen? Yo. So shout out to you, Zen. So Zen and I were on a call last night, consultation. My guy is amazing. He's a young guy in his 30s. I'm not trying to put your business out there, so I won't. But this dude right here, he's a hustler, man. And shout out to him, man. He's legit. Musician, doing his thing. I'm really looking forward to meeting you when you get here, bro. Thanks for the trust in me, man. So I appreciate you. Thanks for the comment. Bliss says, what are 2 top local insurance companies there? Yeah, so let me show you. I would go. So these 2 right here, the local ones right here, the very top, local insurers, Pacific Cross and Bao Viet. If you want to message me on the back end, I can send you information for them. So just message me either on Instagram, or if you have some more to say, then just it's a quick message in Insta. I have a WhatsApp, but hit me up on Gmail. Channel name StoryKT@gmail, and then we can talk. I got you, bro. Don't worry about it. Appreciate the comment, bro. All right, my boy Paper Bag Marketing Group says, in the Philippines, you can't check into a hospital without deposit, and you pay before the service is performed. Yeah, see, yeah. I appreciate that. Marketing, Paper Bag. Thank you, bro. Appreciate you. But yeah, it's definitely different here in Vietnam, because don't get me wrong, if they think you broke, then they're gonna be like, hey, give me a deposit, but the international hospitals, they will definitely probably ask for a deposit too. They're not stupid, you know what I mean? Local hospitals, probably not so much. Again, if it's something serious, the local hospital, they won't even take it. They'll just refer you out, say you need to go to the emergency room. Okay, even though they do have an emergency room, they're like, we're not equipped here. So I've heard some horror stories about the Philippines, and how they do business over there. So about medical and trapping people because they don't have enough money. Nah, bro. That's not it. All right. Thanks for the comment, my brother. All right. Zen says, for sure, our consultation was great. Definitely recommend it for anyone thinking about doing one. Yeah. Thank you, bro. Thank you, brother. Appreciate it. Yeah. Young brother over there, man, you impressed me, man. You're doing your thing. I got you, bro. This guy right here is going to be the next something here, musician. All right, man, he's got like 12 jobs. I was like, you Jamaican? Thanks, man. Thanks for that plug. I appreciate that. Yeah, that's really kind of you. All right, Bliss says, I got your digits, laugh out loud, no worries. Okay. Yeah. Hey, I'm sorry, dog. Yeah, I've been talking to a lot of people, man. So yeah, and plus people don't use the same names of the YouTube. So I'm getting used to your name here, and then Instagram's different, Facebook's different, you know what I mean? So WhatsApp's different. So just let me know who you are on if you've messaged me already. Okay, thanks, bro. Appreciate you. Zen says, I'm a hustler, baby. Watching from work right now. Exactly. I already know. I already know. So you don't gotta tell me, bro. I'm a hustler too, bro. So straight up, Southern California. Shout out to Chicago. Thanks, Zen. I hope you're having a good day, bro. Bliss Horizon says, my boy says, yes, Kev is the real deal. Oh, honest and humble. He is my boy. He is my bro. Thank you, man. Appreciate you. You know what it is. Shoot. You know, when you come, you know, man, you gon' know. Okay. All right. I appreciate it. So nobody wants to come join me and talk? Well, let's talk some cashish. Anybody? I mean, the link right there. You can come on. Don't be scared. You don't have to show your face. You don't have to show your face. I want people to start interacting with my lives. All right. I don't want to just talk to you guys, talk at you. I want you guys to come on up. So I know Unfriendly Stoic, you like to come up and chit chat. So if you ain't scared, come on. But yeah, come and chop it up with me, man. This is what this channel's for. This is what this live is for. All right. But if nobody's coming up, then I'm gonna introduce you guys to this idea that I'm cooking up, right? And it's only gonna be for y'all, okay? I may cut this out once the video when it uploads. So let me share my screen. Let me share my screen. Bear with me. I told you guys in the beginning of this live, I said I'm gonna start doing some different. I'm gonna start doing something different. Meaning, I'm gonna take a trip with some of my subscribers, 10 of y'all. All right. And I have I'll put it this way. I have itinerary, a 3-week itinerary, which you're about to see, that goes from the north, central, and goes to the south. All right. So we're gonna hit for 3 weeks. We're gonna hit each city, right? It might be less. If you want to come on this trip, I'm thinking like May. I'm thinking about May of next year. That way it gives you guys plenty of time to, save up and then come over here. Okay. So I'm gonna set out and what I'm thinking is it's gonna be an all-inclusive packages, right? So you're gonna have to get your own flight here, right? I'm gonna see if I can set up some sort of partnerships with airline travel agencies here locally. See what we can do. I haven't done that yet, but I'm planning on doing that. Okay, so I can get you guys a better deal maybe on your flights. But just a little nugget on your flights, guys. Go to ChatGPT, type in best flights, with your hair. Give me a minute. I'm going to give you my prompt, actually. Give me a minute. See? Just give me 1 minute, guys. Where is that? Okay. Here's the prompt that I use. Here's the prompt. I mean, this is an example, but this is the prompt that I use, okay? Okay. Type this into ChatGPT, okay? Or take a screenshot of this, and it cut off it says the least stops, okay? The least stops. This is just a little nugget for y'all, okay? I'm about practicality on this channel, right? Save money, practicality, less headaches, makes you guys happier, makes me happier, okay? What's the best, this is a ChatGPT prompt, okay? What's the best airline tickets you can find from your city to whatever city you're going to, Da Nang, Vietnam, Ho Chi Minh, Vietnam, Hanoi, Vietnam. I want a round trip ticket, or I want a one-way ticket for your dates, a 7-day trip, a 3-week trip, a 10-day trip, right? Find the best deals with the least stops. Okay. You will be surprised how much money you'll save just from this right here. Okay. Example, from this prompt right here, one of my childhood friends is coming. Okay, this is his prompt that I made for him. And so he went on Google, Flights. He went on like what do you call it? These apps, Expedia and all this garbage. They were charging him. He found the cheapest flight was like 900 something for this prompt with these dates. Okay, and all of them were like 1,000. Then the next day it was 2,000 or 1,200. Then the next day it was 13. Then the next day is 700. Then the next day, so you know how it goes. It goes up and down. So, anyways, he messaged me and he called me and he said, Kev, I'm tired of this shit. Like, I can't find. I don't know, man. I don't know if I'll be able to make it out there. I said, man, hold up, bro. What's going on? And he told me, it's just fluctuating. And I said, okay, just give me a minute. I did this. We came back. The cheapest one that we found was like $493. Yeah. This prompt. Okay. So, boom. That's what you need to do if you want a flight. I would do that. So, anyways, this is what I'm saying is I'm going to be setting up a subscriber appreciation or some sort. I haven't figured out exactly the name of it, but you guys are getting my raw ideas right now. Okay. I'm setting this up for like the springtime. Okay. Like almost summer. So it's going to be around May. Okay. So save up, come and see me. I'll just look out for my videos and stuff. I'll be putting some promos and stuff throughout the videos moving forward about this once I lock everything down. But my idea is it's going to be covering when you pay. When you come in and buy a ticket, we're gonna do some activities in each one of these cities. Pick like one activity or two activities, like big ones, and then we'll have dinner. We'll have breakfast, lunch, and dinner covered. I'm talking about like platinum. You know what I mean? Good shit. So all your food will be covered. Obviously, if you want to get snacks and stuff throughout, I might even try to throw in some snacks and stuff and whatever. So that's going to be all of your local domestic flights, all of your transportation here once you get into the country, right? Whether it's by bus, by metro, by plane, okay? And then we're planning on going to Hanoi, Da Nang, right? Obviously Hoi An as well, and Ho Chi Minh City, okay? And for some of you, if you want to go to Phu Quoc, we can add that onto the week 3. All right. Other than that, everything is going to be covered. Okay. I'll obviously throw some other stuff in there and I'm going to build it. But that's the general sense, is that I want to invite 10 people. It's going to be me and my lady that we're going to go. And then I want 10 subscribers to come with me. Right. It may grow, it may not, but I'm just throwing a little nugget out there for you. Okay. This travel itinerary I've never shown anyone. Okay. So you guys are going to be the first. Okay. You guys are the first. So check this out. Where did I put you? Bear with me. I don't know where I put it. Aha. Okay. I found it. So I need to go here and how come I can't find it? That doesn't make sense to me. Sorry, guys. Bear with me. Technical difficulties, of course. Can I just pull it up here? Okay. Yeah, I don't know why it didn't come up the first time. Man, computers, I swear. I'm like, sometimes I'm like, hey, what's going on here? All right. So this is my travel itinerary. Okay. This is the first one. This is what we will be doing. Okay. And of course that I'm going to be changing up some of this stuff. like the activities and stuff, but I'll tighten it all up, and I'll make it flow for you guys. All right. So let's go over it. So obviously up here, you can see up at the top, this is northern Vietnam, right? So these are the cities that we're going to be hitting in northern Vietnam: Hanoi, Ninh Binh, Ha Long Bay, right? I will go over all specifics after. Okay. Again, this is still week 1, day 6. You can see, right? Ha Long Bay at the top there. Ha Long Bay, right? Right. You see all this? Okay. We're going to be hitting Hue as well. Okay. Week 2, we're going to go obviously to, a smaller little area. This is a cave area, Phong Na. And we're going to go to Hue. We're going to hit Da Nang. We're going to hit Hoi An. Okay. Again, everything, this can change, but this is the idea. And then the last week, we're going to obviously Ho Chi Minh. We're going to go to the Mekong Delta, and then we're going to hit Phu Quoc Island. All right. So that's it right there. That's what I'm going to be setting up. If you guys want to be a part of this, and I'm going to give you more information about this later, but if you guys are interested in Vietnam, you have no idea what the heck to do, or hell, you just want to come and meet me, meet KT, and have a good time, meet my lady, who will be my wife at that point, then you can just come and see us, man. Come and hang out with us. That's what this channel is about. So I'm gonna go fast, okay? So day 1, Hanoi. So you guys will all either fly into Hanoi, or I'll have you fly into Da Nang, or I'll have you fly into Saigon. So wherever I ask you guys to fly into, that's where we're gonna start our trip. So that's what I'm saying. It could go either way. All right. So just how it is right now, we're gonna go to Hanoi, explore Hanoi. You guys are gonna have plenty of time to like hang out on your own. My idea is that we hang out as a group. We ride or die as a group. And then obviously we'll have tour guides, local tour guides that will be with us, the whole time as well. So you can ask questions with them. So it's going to be, I'm an event planner. Okay. So when I plan something, I plan something great. All right. It's not some half-ass shit. Okay. It's not some brother stuff, it's some real deal stuff. All right. And you'll see, you guys will see. That's what I'm good at. I'm good at hospitality stuff. So at the end of the day, I want some good food. I want some good drinks with you guys, even though I don't drink. If you drink, that's cool. I want to get you guys into some 3 to 4 star hotels, if save you guys some money, and then have a good time. That's it. I mean, really, do some activities, give you guys some downtime, come back, have dinner. You know what I mean? So this is the kind of stuff I'm looking at. This is what my mind is. We're gonna explore Hanoi's old quarter. Obviously, check you out some hidden Hanoi. Day 4, we're gonna travel, go to Ninh Binh, right? Hang out all day Ninh Binh. Next day, Ninh Binh, right? These things are gonna change. If I want to pack some stuff into it or take some stuff off, right? So we'll see. Day 6, we're gonna head to Ha Long Bay and go to Cat Ba Island, right? Cat Ba is a island, right? Day 7, obviously we're still going to be in Ha Long, right? Then we're going to travel south towards Phong Na, all right, Nah, and then hang out in that city. Might change, okay? So it's a cave, like I said, that's where the biggest cave in the world is. So, or in Vietnam at least. All right, so yeah, I think that's pretty cool. There's a wait list here for this cave. We're probably not gonna go to the cave, but we'll see some cool stuff. And I might even just change it altogether. Then day 10, we're gonna head to Hue, right? We're gonna chill in Hue. Generally, I'm gonna give everyone an itinerary, the final one, obviously like probably a week to 10 days, maybe even 2 weeks before the actual trip happens. So then you guys will know exactly what, before you get here, exactly what we're doing. Okay. So yeah, Hue, check out Hue. Then we're gonna go take a travel day the next day to Da Nang, right? I want you guys to see the Hai Vong Pass. We might even take a train because it's really beautiful. We might even, it just depends, okay? We're gonna check out Hoi An, right? Then obviously day 14, it's a free day for you guys to go out and just chill out. Then we're gonna fly to Ho Chi Minh City the next day, explore Ho Chi Minh. Day 17, again, explore Ho Chi Minh. Then the next day, 18, we're gonna go to the Mekong Delta, right? Spend a day in Kanto, and then we're gonna go fly over to Phu Quoc, okay? And then we're gonna do that island life, right? And then day 20, Phu Quoc. The last day, return to Ho Chi Minh City, and then you guys fly out. That's the end of the trip. So yeah, that's it. That's what that is. So I'm gonna start promoting these type of things. If you guys are interested in it, just let me know. Like email me or just comment in the comment section of the videos, and I got you. All right. So looks like nobody wants to come on. No questions. I think that's gonna do it for this one. Yeah, hit that like button for me, y'all. And man, I really appreciate you guys, man. I'm gonna go rest my voice. And if you guys have any questions about this, I really do appreciate y'all hanging out and staying with me. If you guys want to support the channel, there's the Cash App at the bottom there. I would really appreciate that right here. I would really appreciate that. If not, just show your support by watching the videos and sharing the videos on your socials for me. I'm really trying to reach 5,000 subscribers, man. I really do appreciate you guys. And if you guys are, again, if you're interested in the trip coming up in May, that you get to meet me and I'm going to take you around for 3 weeks, my subscribers, let me know. All right. But have a good night. Have a good morning. And guys, have a good afternoon. Thanks for joining me, guys. I really appreciate your time. Thank you. Holla.